Today, I am giving you some updated information about Medicare Part D. So if you are new to Medicare, or maybe you need a refresher on how Medicare Part D works, this is the video for you. Medicare Part D is one of the four main parts of Medicare, and in my opinion, it is the most confusing part to understand. Definitely one of the things I get the most questions about. So without delaying too much, I want to just dive right into how Medicare Part D works, and I'm going to answer my most frequently asked questions about Medicare Part D. So if you have Medicare Part A or Part B, then you are eligible to enroll in Medicare Part D, which is the part of Medicare that covers your prescription medications, the drugs that you go pick up at the pharmacy. You can get Part D through either a standalone Part D prescription drug plan or through a Medicare Advantage plan that includes Part D benefits. And we're going to talk a little bit about both. Now, if you have creditable prescription drug coverage, either through an employer-based health insurance plan or through VA benefits, something like that, then you may choose to delay your Part D enrollment. But generally, if you don't enroll in Medicare Part D when you're first eligible, and you go more than 63 days without creditable prescription drug coverage, then you could get hit with a late enrollment penalty if you go to enroll in a Part D plan or a Medicare Advantage plan that includes Part D coverage later on. And that penalty is 1% of the national base beneficiary premium that you pay every month on top of your Part D premium for as long as you have a Part D drug plan. If you have traditional Medicare and you choose to enroll in a standalone Medicare Part D drug plan, then you're going to get your Part D plan through a private insurance company that contracts with Medicare to offer Part D coverage. Part D drug plans can vary from state to state, but in general, nationwide, these plans start at about $5 a month and they can go up to $100 a month or so. Which Part D plans are best for me long term? Which plan will cover the most if I do get sick or have to start taking some really expensive medications down the road? And the answer is, it depends. Part D plans don't necessarily rank in a linear fashion like good, better, best, depending on how much the plan costs. So even if you are taking some expensive heart medications and you have a Part D plan that's just $10 a month, you could still be getting the best overall coverage for your needs compared to a different Part D drug plan that's $50 or $60 a month. So when we look at comparing Part D drug plans, we want to look at the total annual out-of-pocket cost to you for the year. We can check this right on Medicare.gov, and this will add up the monthly premium for the drug plan itself with any out-of-pocket costs you're going to be paying for your medications, including costs paid towards the deductible and any co-pays that you pay for your specific medication. This tool will give you the lowest out-of-pocket cost for the calendar year, and this is generally how I recommend starting when you're choosing a Medicare Part D prescription drug plan. Now, you also want to look at the plan's star rating. Certain plans may have better customer service than others, but in general, if the plan has a decent star rating and it's going to cover your prescriptions at a total annual overall lowest cost to you price point, then it's probably a good choice for you for Part D. Another frequently asked question that I get is, what if my needs change in the future? What if I get prescribed a new expensive medication? And the answer to that is that you can change your Part D prescription drug plan every single year during the fall annual election period. And in fact, you should shop your Part D prescription drug plan frequently, at least every few years, because Medicare Part D drug plans are calendar year contract plans that can and do change a bit from year to year. So in the fall, you'll receive an annual notice of change document that outlines any changes to your Part D plan for the coming year. So you might see the plan's premium change, the way certain medications are covered can change, and lots of people just ignore this document, but it's really important to review. So you can change your Part D plan every year, and you should shop it frequently. Another really common question that I get is about the phases of coverage when it comes to Medicare Part D, including the deductible and the donut hole, the coverage gap. So let's break down how those work. Currently, Medicare Part D has 4 stages of coverage, and this is true whether you have a standalone Medicare Part D drug plan with traditional Medicare or a Medicare Advantage plan that includes drug coverage. There's the deductible phase, the initial level coverage phase, the donut hole or the coverage gap, and catastrophic coverage. So the first phase is the deductible phase. And a deductible is generally the amount that you have to pay in full before your coverage kicks in. So while you're in the deductible phase of coverage, you're going to pay the full negotiated price of your medication until you've met the plan's deductible for the year. Once you've met the deductible, you move into initial level coverage. This is where you pay a set copay or a set coinsurance amount for your prescription. So maybe it's that every tier 3 drug on the plan has a $40 copay. So when you're in initial level coverage, if your medication is classified as tier 3, then you're going to pay $40 when you go pick up that medication from the pharmacy. Most people will stay in initial level coverage for the whole year, and then it all resets every January 1st. However, some people that are taking more expensive medications will move into the third level of coverage, which is the donut hole or the coverage gap. Every month when you pick up your medications, you're paying your copay or your coinsurance, and the insurance company is paying the rest. Once the total amount that you and the insurance company together has paid is $4,660, then you have to start paying 25% of the cost of your brand name medication. So let's say you were taking a medication that is a $500 medication, that's the retail cost of it, and it was a tier 3 and you were paying your $40 copay every month at the pharmacy. Now, when you're in the donut hole, you have to pay 25% of the cost of that medication. And that works out to be $125 on a $500 medication. So some people are surprised when their copay goes way up on their prescription in the middle of the year and they're not sure why. And a lot of times it's because they've fallen into the coverage gap or the donut hole. Now, there's also something called catastrophic coverage on Medicare Part D. That's the fourth coverage phase. And this is when the total amount you've spent on your medications equals $7,400 for the year. This amount is made up of what you pay for your prescriptions plus some of the costs of what the insurance company pays. And once you've reached catastrophic coverage, you start paying a lot less for your medications, usually 5% of the cost of the medication for the rest of the calendar year. Another frequently asked question I get about Medicare Part D is, how does the drug coverage on Medicare Advantage compare to drug coverage on a standalone Medicare Part D prescription drug plan? Is one better than the other? Generally, it's pretty similar because most Medicare Part D drug plans have those 4 phases of coverage, and you're generally going to be subject to the donut hole no matter which way you go. But sometimes you will find superior prescription drug coverage on one type of plan versus the other. It depends on the type of medication that you're taking. And you also want to weigh it against any out-of-pocket medical costs that you may have to pay for office visits or hospital stays, etc. So this is definitely where an independent broker like us can come in and help you. We work with Medicare Advantage plans and Medicare supplement plans. We help all of our Medicare clients with their Medicare Part D prescription drug plans as well. So we can help you determine which type of plan is going to be best for your needs overall, whether you are turning 65 or you're already on Medicare and you're wanting to shop your options. Now, the Inflation Reduction Act, which was signed into law in 2022, includes some really important prescription drug plan provisions to help cut costs for seniors when it comes to Medicare Part D. I'm going to link an article below that goes into much more depth explaining this to you, but some of the most important takeaways are that starting this year, there is now a cap on the cost of insulin, and it's a $35 cap for covered insulin by your Part D plan. Another big takeaway is that as of 2025, there will be a $2,000 cap on annual Part D prescription drug plan spending per Medicare beneficiary. So these things that will happen in the future years are really important, and I have linked more information below that outlines all of that and more for you. Be sure to check that out. I hope this video helped to explain a little bit more about how Medicare Part D works in 2023. If you have any questions, please give us a call. You can shoot me an email. Thank you so much for watching, and we'll see you soon.